This is a two-level transcom in OLLIF. You see the needle on the right L5 as a marker, and here I'm measuring or signing on the skin the trajectory of the disc in AP and lateral. Actually, the surgery starts right now, and the time is 9:20 a.m., where we put the Gemfidi in and we take bone marrow out mixed with our biologic. Here you see that the probe, which is insulated to the tip and it has a metal sleeve outside, enters the disc, and the K-wire goes inside of the disc after we are in a neurophysiologically silent area. So we enter the disc at 9:22, just 2 minutes after we start the surgery. Here we are dilating it, and then we put a tube in, and this tube is 8 millimeter inside, 10 millimeter outside. And now we start our discectomy with a very specialized tool. This is a ring carrot, and here you see some other tools, especially this carrot that you see here. And then the cage is entered first in the lower profile, as you see here, and then turned to final position. We call it in situ rotation. The surgery was started at 9:20, 9:26 or 7, the first cage is already in. Now we put Gemfidi in L4, get more bone marrow. And here again, we use the time to put Gemfidi and the K-wires in both sides, because the patient has a little bit of a scoliosis in the x-rays. We are finishing it before we move on to the next levels to get the best pictures. Now we approach the disc in the 3-4. We get a signal, we reposition it a little. Here, we reposition it, we enter the disc, and then perform a discectomy. And again, in what we call in situ rotation, the cage is entered in lower profile and then turned into higher profile and then advanced a little more. Now, we put the Gemfidi and the K-wire in L3. And at this point, the AP machine goes out. Then we use this decorticator, and the screws are entered on their lateral view. And then the rod is passed from superior and locked in place. And this is the final AP and lateral view. Remember, we started surgery at 9:20, 9:53 or 52. We actually have our finals. Then we spend a few more minutes to close those small holes. So the whole surgery in this case was about 37 minutes for two-level fusion. This patient is doing great. These patients are able to go home, even elderly, are able to go home same day or latest next day. Generally, they are able to go home even same day.